Okay. And it's a total of 8 questions. It's just kind of general questions. Why did you choose this profession to be in occupational therapy?
I chose this because when I broke my neck, I had 6 months of all therapies, and I felt like my occupational therapist gave me the most functional return.
Really?
And it was very interesting to me, and I thought, I'm going to try.
Wow, and that's when you decided that you'd love to be an occupational therapist. That's great.
But all they can do is say, we're not accepting you.
Yeah, that's very true. Well, that's awesome. That's really
that's
nice.
Why.
Second question would be, how long have you been working in occupational therapy?
I have been a therapist since 1985.
1985?
Mm-hmm.
Okay.
Over 30 years.
Over 30 years. And you love it till today
I
still,
still
right?
like it. Mm-hmm.
Your patient
That's great.
from earlier, is she still working?
No.
What advice would you give to someone pursuing occupational therapy?
That to do it because you want to help people maximize their function, whether it be kids or adults, and you have to like people. If you don't like people, you don't need to be doing this, and you need to be able to touch people.
Right. Okay. What was your favorite part of going through OT school?
Clinicals. Probably everybody's answer.
The clinicals, the actual doing part?
Out on your clinicals.
What was your first degree in?
That is my only degree.
Oh, that's your only degree?
Mm-hmm.
Okay. So you just went straight into OT school?
I did.
Okay, you just applied for it and they used your, did they use your,
I went to the University of Missouri,
uh-huh.
and you had to have 2 years of prerequisites, and then you got into the program.
Okay, wow, just kind of specified prerequisites.
They
Okay.
told you exactly what they needed. Some of them had to be done at their school, some of them didn't have to be. And you just got your prerequisites and applied for the program and waited to see if you got in. You interviewed in, I want to say April, and they let you know by August, the end of July, the last week of July, whether or not you got in the program or not.
Wow, so almost
And
a 3-4 month wait.
Yeah, you had to wait a while because they had to interview everybody.
Right, which was a long
Yeah.
process doing that.
They didn't interview, of course, everybody who applied, but they interviewed about 150 people.
Over 150 people, wow.
Yeah. 182, I think, is what it was. Now that I'm thinking about it.
Do you know how many people they accepted out of that? Or it was
25.
25. Oh my gosh, that is crazy.
They had a lot of people apply, but they narrowed it down to 182. Kind of like your program, where there's lots of people applying.
Right. Well, that's so interesting.
Yeah.
Has any past patient stood out to you?
Well, I've been a therapist a really long time, so I remember a lot of patients. I can't think of any one particular one.
Okay.
I've just seen so many.
Yeah, there's so many. You can't hardly choose from anybody. Let's see. If you weren't in this occupation, what do you believe you'll be doing?
I would probably be a rehab counselor. Yeah, for disabilities. Whoops,
Oh, no, you're fine.
For a voc rehab counselor. Like that, voc rehab counselor.
Okay, voc rehab.
That's what I think I would have done.
Okay.
Or a school career counselor.
Or a school career.
I don't think that high school kids get enough counseling.
That's very true. You're right about that. And last one, if you could give me any life advice, not even relating to OT, what would it be?
Make sure you get your degree in something that you like to do. So that you're like me, and 30 years later you still like it.
Still love it. That's great. All right. Thank you so much.
All right.
How are you doing?
Doing good. How are y'all?
Good.